The Ensuring Access to Quality Complex Rehabilitation Technology Act of 2019 is an important bipartisan bill that deserves more attention. It was introduced in the House by Representative Sensenbrenner F. James Jr. on April 30th, 2019. As of date, November 11th, 2019, this bill has 33 co-sponsors from both the Republican and Democratic parties. This bill would ensure access to complex rehabilitation technology and products for individuals with severe medical needs and conditions. Individuals with medical conditions such as cerebral palsy, muscular dystrophy, multiple sclerosis, spinal cord injury, traumatic brain injury, spinal bifida, and other conditions face many physical and functional challenges and have specific needs that cannot be met with standard durable medical equipment, which is what is currently available to these individuals. Medicare's DME benefit category was created over 50 years ago to address medical needs originally for older individuals. Over the years, technology has greatly advanced and became customizable and unique to the user. Even though this technology has evolved, Medicare's guidelines and policies have not changed or been updated with these advancements. CRT items include products such as specialized wheelchairs, specialized seating and positioning systems, as well as other mobility devices that require unique configuration, evaluation, fitting, and programming. Unlike standard DME, CRT items require a broad range of services and involvement of specialized personnel. This bill aims to create a separate benefit category under the Medicare for complex rehab technology, which would allow for targeted coverage and payment policies that address the unique needs of individuals with disabilities. This bill also aims to create a separate payment category for CRT items, billing codes for CRT items, as well as establish clinical conditions for coverage to ensure that items are being prescribed appropriately. Additionally, this bill sets quality standards and accreditations for specific CRT items and their suppliers. Throughout the years, versions of the same bill have been introduced to both the House of Representatives and Senate, dating as far back as 2011-2012. Versions of this bill were introduced to the Committee on Energy and Commerce and the Committee on Ways and Means and the Subcommittee on Health. These bills have never pushed through the Subcommittee on Health. The current bill was referred to the Committee on Energy and Commerce and to the Committee on Ways and Means. However, no further actions have been taken. Stakeholders state that the 2019 bill is less prescriptive than previous bills, which they believe will improve the chances of the bill passing and centers of Medicare and Medicaid services embracing it. An example where the bill is less prescriptive is that one provision requires CMS to establish an additional designation for providing complex rehab above and beyond the assistive technology profession within a year and implement it within 2 years, but it allows the agencies to work with stakeholders on specifics. Additionally, a few provisions were dropped from this version of the bill entirely, like the provision that addresses the replacement of items and the provision that addresses the ability to provide CRT for patients in skilled nursing facilities. According to Birkeland, official or formal actors are participants whose direct or indirect involvement is motivated or mandated by the official position in government agency or office. There are several former actors involved in this bill, such as the Senate and House of Representative members and the Centers for Medicare and Medicaid Services personnel. The Congressional Committees on Energy and Commerce, Ways and Means, and the Subcommittee on Health are also directly involved in the ongoing assessment of this legislation. The Congressional Budget Office will help determine the economic advantages and disadvantages of the proposed legislation. If the legislation is passed in both the House of Representatives and Senate, the President will be another formal actor involved in this policy. According to Birkeland, unofficial or informal actors are participants who do not have constitutionally or legally created incentives or mandates to be part of the process. A model used to analyze this bill is incrementalism. According to Birkeland, changes within an existing policy are accomplished in small increments, and that small decisions underlying the bill must be made prior to the bill's implementation. For this legislation to be successful, small specific decisions about funding, budgeting, provision, and coverage must be decided on. First steps to ensuring access to CRT products are being taken by this bill. The vagueness and lack of specifics within the bill concerning funding, provision, and training is a barrier to the implementation of this legislation. This lack of detail may drive officials away from supporting and co-sponsoring this bill. There are economic and political obstacles related to the implementation of this legislation. Monetary funds are required to implement and provide CRT products and services. Some may think that factors of this legislation may be costly and therefore may not support this legislation. Some officials and groups may think that taxpayer dollars may be better spent on other pressing issues. To implement and run this program, funds would either have to be redistributed from other things or additional funds may have to be gained to finance CRT products and services. Another barrier to this bill is that it is not politically salient. It may not attract a lot of social attention. A legislation that only impacts a small, specific population may not attract a lot of media attention. The mentioned barriers do not minimize the importance of ensuring access to complex rehab technology. To gain salience, proponents of this policy urge advocacy and actions from both formal and informal participants. Many associations are involved in this bill, such as the American Occupational Therapy Association, the American Physical Therapy Association, American Association for Home Care, Brain Injury Association of America, and many others. Strong advocacy efforts for CRT continue from many organizations and associations. It's important that formal and informal efforts continue in order for this bill to gain salience and for it to be implemented. If individuals with complex medical needs are unable to get the appropriate necessary equipment, the lack of needs met could lead to a decline in further function and a poor quality of life. This decline could potentially result in increased need for further rehab services. If this bill is enacted, occupational therapists will potentially have the first-hand experience in evaluating and treating individuals and their caregivers to ensure proper individual configuration and use of prescribed CRT items. Occupational therapists will work with individuals with medical conditions to assist in helping increase independence in daily activities to increase the quality of life of each individual.